Okay, thank you very much everyone for joining. We're starting our webinar seminar now. It's 8 o'clock. I'm checking at the time. Thank you very much. This talk is not intended to diagnose or treat or prevent any disease. It's just intended to give advice. If you're experiencing any health concerns, I would suggest you consult your doctor. My name is Princess Glory, and I am speaking on behalf of Gloriedo Nutrition Limited, and I'm not responsible for any adverse effect that you might have as a result of any of the things that you hear today. Who is Princess Glory? Princess Glory is a wellness coach and a nutritionist. I have been very passionate about healthy living for over 14 years. So I decided to set up my business due to the things that my body obviously reacts to food and what I've observed from the clients I have been seeing for over the years. I love cooking and I love eating good food. And I believe that food can heal any disease, being a wellness coach for over 5 years and also a detox specialist. We have our weekly talks every Thursday. Today's talk is on lupus and a Black woman. Next week, we're going to be treating arthritis, and the week after, it'll be Lyme disease, and then diabetes, and then blood pressure. So if you know anyone that suffers from any of these things, if you please contact them or share the link so that they can join us. What are the services that Gloriedo Nutrition offers? We offer health scan to detect the things that might be wrong in your body. We also offer essential oils, body and skincare products. We do seminars and workshops every week. We also do talks in schools and also in churches as well. And we offer meal plans and ready meals and also cooking classes. And what are you going to be learning today? We're going to be talking about lupus, the things that causes lupus and the symptoms, types of lupus, how lupus affects your brain, your eyes, your ears, your kidney, and also how lupus affects women during pregnancy. We're also going to be talking about the foods that contribute to making lupus worse and the foods that you can eat if you've got lupus as well. Just wanted to start off by talking about the scan, because this is one of the services that we do. Because of the Queen Jubilee, I know I've got 10% off discount on the poster. I've decided to do 20% off. The link is on the chat. So if anyone would like to book a scan for their family or their friends, or just give to them as part of the Jubilee celebration, you can do so as well. So it's usually 150, but today we're doing it for 20% off. Fact about lupus. I just wanted to answer a couple of questions or things that people would like to ask about lupus. So lupus is a disease that affects the immune system, and it makes the immune system to become overreactive. Some people think that is the opposite of AIDS. You know, we've heard what that is. HIV/AIDS is the opposite of that. This is an overactive immune system that ends up producing too much antibodies, which is obviously clogging your body or damaging delicate organs in your body. So who gets lupus? Men get lupus, women get lupus, but the majority of people that suffer from lupus are usually female, between the age group of 15 and 50. And there are usually many people that suffer from them, even though women suffer from them the most are more Black and Asian women suffer from lupus. So lupus is very common. One in approximately 1,000 women will be estimated to have lupus. Lupus is multiple sclerosis or leukemia. They're like the same sort of group. Which countries are most affected? Afro-Caribbean countries and Chinese people get affected by lupus. And when they do the tests to find out if you've got lupus, there are 3 things that they tick on the blood form: ANA, DNA, and ACL. Those are the things that they will tick when they're doing the tests for you to determine if you've got lupus. So what are the treatments available? Normally, they'll give you anti-malaria medicines, they'll give you steroids, immune suppressants, they'll give you that as well to help. Those are the sort of medicines that they give in the hospital. And those obviously are also some of the medicine that they use to suppress blood pressure and also reduce osteoporosis and all the other symptoms to do with arthritis as well and pain. So what exactly is this lupus that we're talking about? Lupus is an autoimmune disease that affects your immune system. It attacks the tissues and the organs. The lupus is an inflammation. We talked about inflammation last week, and it affects different parts of your body. So lupus affects your kidney, your brain, your nervous system, your heart, your lungs, your blood vessels, and more. Lupus affects different people and has different symptoms. Some of them build up over time, and some of them are mild, while some of them are very severe. Most cases of lupus obviously are categorized by flare-ups, where symptoms temporarily worsen and then disappear over a period of time. So lupus is unpredictable and is a complex autoimmune disease that causes inflammation, which obviously we've said damages the parts of your body. Lupus is not contagious and cannot be given to another person. Lupus is not like HIV or AIDS or any of those infectious diseases. 90% of people who develop lupus, like we said earlier, are women. Men also develop lupus, and their disease can also be severe as well. So let's visualize lupus and where it can be located in the body. I just decided to first of all put statistics of how it affects women in America. Over 1.5 million Americans are people that suffer from lupus, and they're between the ages of 15 and 44. Women of color and Caucasian women suffer from lupus. Lupus is a leading cause of premature cardiovascular disease, kidney disease, as well as stroke. 70% of lupus cases are LSE, which I'll explain in the course of the talk. 6 years in average is the length for which people can get a diagnosis for lupus. I saw a lady from Nigeria that had lupus for such a long time. It took 15 years for them to diagnose that she had lupus. 63% of lupus patients are incorrectly diagnosed at first. So let's see all the stuff that lupus does in the body if we visualize it. Lupus affects the face, it affects your hair, it affects your mouth, it affects your esophagus, it affects your stomach, your colon, your rectum, your liver, it affects your blood, affects your blood vessels, it affects the heart, your eyes, your brain, it affects babies as well. So if you have lupus, it can affect your children as well. Lupus is also can be found in the lungs, in the joints, and also in the muscles. Symptoms of lupus on the face. I don't know if for some people, they've probably seen people that have like a butterfly mark on their face. It starts from the nose and it goes around to the two sides of your face. Lupus can also be in the stomach, and that can make your stomach to be inflamed and full of fluid. So people that have lupus in the stomach area, for example, will have things like nausea, vomiting, fever, and constipation. Some people, when they have lupus, they lose their hair as well. It makes their head to be weak. Lupus in the mouth affects your cheek, your lower lip, the roof of your mouth. It makes your mouth to be dry and also lead to dental decay, gum disease, and also difficulty swallowing. Lupus, when it affects your esophagus, it can cause difficulty swallowing food, causes a lot of acid reflux, heartburn, and gas. Lupus in the stomach, when it affects your stomach, you have things like diarrhea, constipation, and you find that lots of people constantly using medicine to help cure constipation. If you have lupus in the pancreas, people do take medication for that, but it also causes an inflammation in the pancreas. People that have lupus in the colon or in the rectum causes bloody diarrhea or bleeding in the lining of your rectum. Lupus in the liver makes the liver to be inflamed and enlarged, and you could also have jaundice as well. And when you have lupus in the kidney, there's blood in your urine, and also that can cause problems with your kidney. Lupus can also affect your blood, and that obviously makes people to be anemic, so they have low blood counts. Lupus can also increase the likelihood of you having blood clots. Lupus in your blood vessels affects you, and it makes you to have like purple or red dots on your skin, which can lead to tissue death. Lupus in your heart can cause your heart to be inflamed. It can cause scarring and restricted blood flow, as well as formation of blood clots. For those people that have lupus in the eyes, it causes extreme dry eyes. I've seen a couple of clients that have had dry eyes as a result of lupus. Some people have swollen glands when they have lupus you see that they have swollen tonsils as well. Inflammation of the lung can cause them to have difficulty breathing or pain when they breathe. When people have lupus in the joints, it causes swelling, stiffness, as well as a range of motion. When they have lupus in their muscles, it causes aches and pains in their muscles. Again, just going over some of the things that we've talked about earlier, lupus is an autoimmune disease. It's diagnosed between the ages of 15 to 44. 90% of the people that have lupus are women. Black people are of a higher risk of having lupus. Usually they are treated by rheumatologists. Most people test positive when they do the lupus test by blood, and obviously the ANA blood test. Medication that could be used for lupus is hydroxychloroquine. That's obviously one of the things that you can use. We've talked about this so many times, the things that affected your skin, your heart, your kidney, your blood, your muscles, and your joints. So what are the types of lupus that are out there? There are 4 types of lupus. You've got the lupus that affect the children, neonatal lupus. You've got the cutaneous lupus, you've got a drug-induced lupus, and also the LSE, which is systematic lupus. That's another type of lupus that they are. So when somebody has acute lupus, they have the butterfly rash around their cheek and their nose, like you can see in the picture. Some people have lupus and they have it all over their skin. So if you see anyone that has this sort of sore scars on their skin, you know that that's lupus. People have like red, purple rash, discoloration, and scarring. So if you see anyone that has this kind of scarring on their hair or hair loss, sudden hair loss, you know that that's lupus. Sometimes people don't know what it is, so people keep going to the doctors to get tested, and doctors sometimes are not able to tell them for a while what it is. You know, they give them different medication. Lupus causes hair loss. It causes you to have headache, high fever, butterfly rash, like we said. It causes nose and mouth ulcers, abdominal pain, blood in the urine that obviously affected your kidney, and also muscle pains and swollen joints. So what are some of the symptoms of lupus? Fever, fatigue, chest pain, achy joints, butterfly rash, mouth ulcers, kidney disease, weight loss, and other skin rash, as well as swollen ankles. Some of the problems that people that have lupus has are eye problems, lung inflammation, kidney disease, rashes, joint pain, osteoporosis, blood clot, anemia, heart disease, and thyroid disease. So what are some of the foods that you need to stop eating that would make your symptoms to be reduced? You need to stop eating anything that's got gluten in it, so bread. You need to stop eating rice. You need to stop eating pasta. So anything that contains gluten, you do need to avoid. And you need to avoid things with high salt. So high sodium foods, you need to avoid. Alcohol and caffeine, you need to avoid as well. And foods with added sugar needs to be avoided. So what are the best foods for lupus? You can have mackerel, but I obviously tell my customers not to have mackerel though, but you can have salmon, you can have snapper, swordfish, tuna, sardine, catfish. You can have a bit of chicken, turkey, and shellfish. Those will give you vitamin B. You can have fruits like apricot, berries, cherries, plantain, mangoes, avocado, peaches, nectarine, grapefruits, banana, and papaya. And other foods that you can have in the vegetable category are spinach, kale, bok choy, broccoli, sweet potato, pumpkin, carrots, squash, mushrooms, cauliflower, beets and onions and garlic. You can have that. In terms of grains, nuts and seeds, you can have oat, wild rice, and seeds, chia seed and flax seed. You can have the oils that you can have are fish oil or flaxseed oil or olive oil or any omega-3 fatty oils you can have. In terms of vitamins, you can have vitamin D, vitamin A, vitamin E, vitamin B, vitamin C, selenium, calcium, and also vitamin K. You can have turmeric, ginger, probiotic, yogurt, and fermented foods as well as bone broth. Autoimmune disease, like we said, is lupus. So some of the things that you also need to avoid as well are dairy. You need to avoid corn, eating anything that's got soy in them, eating anything that's got eggs, you have to avoid that. You have to avoid yeast and also citrus fruits as well. Common things that brings toxin to your system are sugar, alcohol, caffeine, GMO, so anything that's genetically modified will cause problems as well. Artificial sweeteners as well, processed food, junk food, and anything that contains trans or hydrogenated fats you should avoid. So what are the foods that you should eat? Fish, we said already, fruits, vegetables, whole grain, you can have. Foods to avoid, sugar, processed food, garlic, you should avoid as well. Okay, this is another type of lupus. It's called lupus mimics, and this, obviously, some people have lupus, but they also have rheumatoid arthritis. They have the one that affects the skin rash. They have tissue disease, connective tissue disease. Fibromyalgia is also another type of lupus that is waiting to manifest. So the best natural treatments for lupus are, basil. You can have that. It helps the enzyme to flow into the skin, reducing the swelling. You can have turmeric, which obviously reduces the inflammation as well. Flaxseed oil helps to heal the lupus and to treat the lupus rash. You can have ginger, that helps to reduce the redness on the skin. You can have castor oil, it prevents flaking of the skin, as well as the rash and the sores that you might have. Foods that you can have to help with the treatment of lupus include avocado. That's a great source of fatty acids, and is also beneficial in the healing of lupus. Coconut oil is also good as well. You can have probiotics, you can have probiotic drink, you can have probiotic yogurt, you can have fruits and vegetables, raw milk. If you get raw milk from the animal, you can have that. But I really do tell people not to take milk, because obviously you might have other issues as well that could come up as a result of taking milk. Turmeric is good, you can boil it. So if you wanted to have a turmeric drink to help with lupus, you can boil it, stir it up for a few minutes and drink it, mix in honey and drink. So what are the tips if you have lupus? Avoid high sodium food, like I said, that would also help to reduce lupus. Avoid any processed food like potato chips, like fries, or anything that is fried in unhealthy oil or palm oil. You can avoid fast food as well, eating restaurants, fast food. Avoid those. Avoid gluten, we said already, wheat, bread. Those things will cause inflammation and also bloating underneath your skin. Avoid alcohol, because it makes your immune system to be weak, and also avoid things with caffeine. So you can avoid having coffee, because that would make you to constantly have headache. Symptoms of lupus, we've talked about. How it affects your kidney. It impairs the ability for your kidney to get rid of waste and toxin. How it affects your heart is that it causes your heart to be inflamed, and the membrane that surrounds your heart, which will cause chest pain and other symptoms. How does it affect your lungs? It causes inflammation of the lining of the chest cavity, which causes pain with breathing, as well as causing pneumonia as well. So in terms of people having lupus in their brain, or how lupus affects their brain, is that it causes headaches, causes dizziness, depression, memory disturbance, vision issues, seizures, stroke, as well as changes in behavior. Just gonna go quickly to how lupus affects the different parts of the body. If you had the SLE type of lupus, and when it affects your brain, you're constantly having memory loss, you're confused, constant headaches as well. If you had lupus, the LSE lupus, it affects your mouth. You have sore in the mouth and also sores in the nose. For those people that have LSE lupus, they have shortness of breath or pain in the chest. They have pain in their finger toes, in their nose. They have fatigue and unexplained fevers In terms of the eyes, it causes you to have dry and puffy eyes and increasing of light sensitivity. So people don't really want the light on if they had lupus. And also they have the butterfly rash on their face, around the cheek, around the nose area as well. And that worsens when they go out in the sun. When somebody has SLE lupus, they have vomiting that affects their stomach. They have bladder issues as well as blood in the urine, persistent pain as well in the joints and in the leg. So what are the warning signs of lupus? Flare-up, aching pains and joints, development of rash, hair loss, headache, dizziness, abdominal discomfort. These are some of the things that affect people when there is a flare-up with lupus. So these are some of the stomach pains with lupus. Before you eat, you have pain for no reason. You wake up and you're feeling pain in the stomach. You know, you're overdoing things. While you're eating, you're having pain. After you eat, you have pain. When you take medicines, you have pain. When you go to bed, you have constant pain in your stomach. So some of the symptoms or signs that you know that you probably are beginning to develop lupus or you already have lupus is that there's change in your urine, swelling and high blood pressure increases. For some people that have lupus as well, they have seizures, headaches, and neuropathy. For some people, it's chest and the pain, trouble breathing, lung disease, and heart valve disease. For others, it's anemia, low blood cells, white blood cells, and pallets as well. So how does lupus affect us when we are pregnant or when you're getting pregnant? Or one of the lupus that affects women and is obviously diagnosed within the ages of 15 and 45, like we said earlier. Flare-ups, we already talked about. You get headaches, you get nausea, you get bleeding, you get urine, stuff in the urine. With close monitoring of pregnant women, you know, they can safely have their babies. The effects of lupus on pregnancy can cause menstrual cycle irregularities and other conditions that may affect fertility. On the mother and the baby, there could be severe flare-ups that could lead to kidney issues, as well as preeclampsia. Some babies develop lupus as well as a result of transference from their mom. So how do I manage lupus if I'm pregnant? You monitor your lupus and stay rested to prevent flare-ups. Constant checkups with a doctor to make sure lupus doesn't get worse. Massage therapy as well as yoga, and to relieve joint pains and muscle pains. So for those people that have lupus, these are some of the tips that could help you if you're trying to get pregnant. You need to promote, change your diet, eat the right things to promote ovulation and enhance fertility. Also supplements, you know, you go to take some supplements like vitamin B and vitamin C, vitamin D. Those supplements will really help your immune system. Also stress, reduce stress, that would prevent the activation of lupus, and staying in the sunlight will make your lupus worse, and that obviously will put you in a lot of pain. Some of the products that you can use for lupus that we have are probiotics, vitamin B, very high strength vitamin B tablets, vitamin E, vitamin A, and vitamin C. They're some of the products that you can get from us today. I think the link to the website is on the chat, and you can order some if you wanted to. My last and final tip before we leave tonight is that if you do have lupus or any of the things, and that you visit the doctor regularly for regular checkup instead of only see your doctors when the symptoms worsen. Try to avoid stress, you know, change your diet, exercise, that can help the complications as well. Be smart, you know, make sure you have sunscreen on, and also make sure you cover yourself with a hat when you go out and when it's very sunny. Get regular exercise. That will help to keep your bones strong and reduce your risk of heart attack, and then also promote general well-being. Try to reduce your stress, because because stress would usually make the lupus to flare up and cause more inflammation. If you smoke, I'll advise you to reduce it or stop smoking, because that would really help your lupus to get better. But if you continue smoking, that would cause your lupus to get worse. Eating a healthy diet, we've made a couple of suggestions of things that you could have. You could have lots of fruits and vegetables, but I would suggest you try your best not to eat any fruit or vegetable that is high in sugar, because that would obviously make your thing flare up as well, especially for people that have high blood pressure, kidney damage, or gastrointestinal problems. Thank you so much for listening to my talk. I try my best to finish on time every time. If you would like to contact me today, my number is on the screen. We've got a website where you can buy the products today, vivonutrients.com. If you want to look at all the other things we do, you can also visit our website, gloriedoorganic.com. And if you are not following me already on social media, my social media handle is Gloriedo Nutrition, Gloriedo Organic, as well as Chef Imani's Kitchen. Those are the ways that you can contact me. Thank you so much, everyone, for joining. If you have any questions, you can ask now. If not, I will see you guys next week, Thursday. Thank you so much again.
I got a question.
Yes.
My name is Rosemary, and I suffer with rheumatoid arthritis. I do get flare time after time. Can you recommend me the best food I should avoid having rheumatoid arthritis?
Avoid things that have got sugar in them. So avoid fruits like pineapple. Can you hear me?
I can hear you now. Pineapple, okay.
Yeah, pineapple, because it flare up with sugar. Melons as well will also flare up. It will cause you to have flare up. Rice,
okay.
Yeah, rice, basmati rice. Do you eat basmati rice?
Yeah, I love rice.
Oh, well, I'm so sorry. You'd have to change rice.
Oh my goodness. Okay, I was stop eating rice.
Basmati rice is GMO. I don't know if you know what GMO is. So when you have those pain, if you could do this experiment next week when you come, you tell us what you've experienced. So from now till next Thursday, do not eat rice. But on Wednesday, eat rice. Yeah.
Okay.
You find that you would either have pain in your joints or swelling in your ankles or in your knee or in your shoulder. So I'm telling you to stop it for a week so that your body thinks that you're not having them. And then when you have it, you see the flare up, so you know that that's one of the reasons why you're having pain. Tomatoes as well, something that you shouldn't be having if you have a
jaundice. I heard about that, not to eat tomatoes, and I can't stop eating tomato now. I have to stop eating now. Now that you're saying it now.
Yeah, so tomatoes is one thing that you need to stop. And what you can do, you can text me. I've got a Telegram channel. I post a lot of stuff, and I could also send you specific information on all the lists of foods that you can avoid.
Yeah.
And if you wanted to come and do I've got an arthritis combo that you can buy that will really help. Yeah. Yeah.
Thank you.
Yeah, cool. Thank you so much for asking the questions. I hope I was able to answer all the questions. But yeah, who invited you, by the way, if I may ask?
Norma.
Oh, thank you, Norma, for inviting her. Yes, Norma's got my Telegram stuff, so she can send you my details, and then you can follow me from there and ask any questions.
Okay.
Yeah.
Right.
Yeah. So hopefully I'll see you next week, because next week we're talking about arthritis. So we'll talk about all the stuff that you should eat and you shouldn't eat, and all the other things. Yeah. Cool.
Okay.
Thank you so much. Anybody else has any question to ask?
Thank you.
If not, we have finished. Okay. Rice, you can avoid rice as well. Bread, potato, white potato.
Bread and potato. Right.
And anything that's got wheat, like bread, bagel, avoid. Baked things like gluten stuff, you can avoid that as well.
Thank you.
Thank you so much. Have a wonderful evening, everyone. See you guys next week. Thank you. Please invite your friends. Thank you. Thank you, Norma. Bye.